Hello, welcome back to Ask Giri the Physio Show. I am your host Giri Srinivasan. Today's topic is amputee rehabilitation. We're going to talk about briefly the causes, types, phases, and what physiotherapists can do if you have an amputation done for you. It can be upper limb, lower limb, or anything. Okay, let's talk about it. Number one, history. There's a very long history for amputation, goes to 1500s. And the picture you see in the slide is your 18th century picture of how they performed amputation in those days. It's pretty scary, isn't it? Luckily, we don't have to go through that now. It's much more sophisticated to have an amputation now. It's a quite traumatic event for anybody's life, right? What are the causes? What are the, we call it 3 Ds. What are the 3 Ds for amputation? One is dead, that means gangrene or kind of a dead limb because of the vascular supply is cut off, things like that, severe gangrene, infectious gangrene, things like that. And dying tissue, because of any kind of crush injuries. We do have patients right now in our clinic with crush injuries, and they have to go through the amputation, and that's kind of a hard thing to do because it comes suddenly, and one day you're here and the next day you're losing a limb. It's a really hard one to digest for anyone. Then cancers and tumors, osteosarcoma, melanoma, things like that can come in any part of your body. Sometimes you have to get rid of that part of the body to survive and for the rest of the life. The third D is for damn nuisance, right? So it can be any kind of lot of congenital anomalies where people have lack of one arm, or arm can be only this short, then hand will be here, or both sides like that. Somebody congenitally, both arms, both legs, those are also possible. So sometimes you have to amputate, get a functional prosthetic, and lead your life in that way. So those are the 3 main Ds, keeping it very short for you for the causes. We can go in details on all of them, which I don't want to get into that. Now, amputation levels for the upper limb and lower limb mainly we are talking about here. There are different levels you can amputate, depends on the location of your injury or the kind of a tumor or whatever it is, and then people will decide what you wanted to kind of preserve most of your body part as possible. You try how much we can save and protect your life. And there is, you can see in this slide, what are the different areas you can have amputation when there is crush injury or osteosarcoma or anything like that. Upper limb and lower limb. In the clinic here, we do have both upper limb and lower limb amputation patients. Right now, we have more lower limb than the upper limb amputations patients with us right now in our clinic. We do have the infrastructure for treating amputee patients. You need low mats, you need parallel bars. We have a couple of parallel bars, and that staffs are trained, and also therapists are very interested performing that amputee rehab for the last 20 years. And we take pride in our rehabilitation protocol for amputees. Phases, right? This is modified from Esquina and Mer cited in a paper. These are the 7 stages here. We'll see. The first is the pre-operative stage. Pre-operative stage is mainly preparing yourself for that amputation. This is mainly for the conditions like gangrenes and osteosarcomas and things like that. But when you have a traumatic event, you don't have time, lots of time to prepare yourself for the surgery. For example, the crush injuries, and I have a patient who is a mechanic and who car fell on his leg and crushed his leg, and he didn't have time to prepare himself for the surgery. It is a very sudden thing. It's always nice to have time to prepare. Sometimes we don't have the time for preparing. So that's when a physician, a surgeon, and also physical therapist prepare the patient what to expect after, and even a prosthetist sometimes involved in that care as well. Amputation surgery and reconstruction, that's totally a surgeon's job. They do a fantastic job in Edmonton to do very good amputation surgeries, creating a nice stump for the rehab process. Then comes your acute post-surgical. It's mainly to reduce the pain, the swelling control, prevention of infection for the stump and the other parts of the thing, getting you back kind of to a vital signs normally and everything. That's mostly the job of the physician, the surgeon, the nurses, all the acute care team, and that's where it comes in the hospital stage. Next comes your acute post-surgical, and that's exactly what we talked about now. Now the pre-prosthetic stage. The physiotherapist's role is very big in this pre-prosthetic stage to make sure the stump is in proper shape and proper condition, and also no contractures, proper strength, proper mobility, and other parts of the body are strong enough to take care of the prosthetic and to walk with the prosthetic, to lift yourself up. And I'm talking about the lower limb amputation. So that job is very big job, and stump bandaging and everything has to be done in this area, and proper care. And a physiotherapist role is very big in the pre-prosthetic. Prosthetic prescription stage, we have prosthesis coming into role, and we mainly work with Northern Alberta Prosthetics and Orthotics in town. Scott and his team is really great about that, working with them. They help us with this prosthetic prescription and everything. Then prosthetic training is a combination of OT, PT, and prosthesis together, along with the physician and the other team and the patient and the caregivers. This is a very important part where we make the patient to bear weight on the stump through the prosthetics, make them stand and retrain everything we're going to talk to in detail later. The prosthetic training comes in. Community integration, next stage is the social worker comes in, and then part of that and integrating them into that community to whatever they want. Their goal is they want to go back to work, and then that comes to become vocational rehab, or they want to go shopping, spend time with the kids and the family, going for a walk, or whatever their goals are. Community integration is very important. Vocational rehabilitation, whatever your job was, are you able to go back to the original job, or we have to go into the modified duties, or you have to do any kind of retraining yourself to go into different job. So those things will be taken care by the vocational rehabilitation therapist, and also the occupational therapist and social workers in guidance and in cooperation with the physical therapist and the prosthetist. Then the last follow-up, when your amputation is done, you're going to have a regular follow-up throughout your life to make sure that everything is working properly, prosthetics working properly, you're not weak anywhere, you are following normal procedures and guidelines to get yourself stronger and reach towards your goal. So that is the follow-up there. So these are the phases quickly, and different team members comes into role. So next slide I'm going to show you is what are the team members involved, so that you have an idea of how many people are involved in your care. If you see that picture in the slide there, you see the circles there, the inner circle and the outer circle, and you are in the middle as a patient. You see how many faculties are involved in the amputation rehab, and every single person in the team is very important for the amputee rehabilitation. And working collaboratively and the multidisciplinary approach and with the great communication is the hallmark of amputee rehabilitation. Okay, and you're starting from your surgeon, from the physician, hospital, nurses, and the OT, PT, prosthesis, and social worker. And the very important thing here is the peer mentor. Okay, with amputees, we always train peer mentors, so who can come and talk to you about their experiences having an amputation and share their experiences, so that you don't have to live it again. You can learn from them and modify things. A peer mentor is a big thing in amputee rehab, and there are trainings for peer mentors available. You can check out an Amputee Coalition of Canada website, and there are training for peer mentors, so you can be a peer mentor as well to some amputees to enhance their lifestyle. So that's the team picture. So far everybody's doing okay? Cool. Rehabilitation. Okay, there are 5 main stages of rehabilitation here. First is you first have to heal the stump, heal your body, heal your mind, and start physiotherapies. Physiotherapist comes pre-operative, post-surgical, acute, and also subacute right away there. Visiting the prosthetists and have an appointment with them, discuss your goals, and they come up with the proper prosthesis for you guys. Then you have to choose your artificial limb based on your goals. Are you going to return to work? Are you going to return to sports? What kind of sport? So your prosthetists will have to know everything about you, and they will design the prosthesis for you guys. And also learning to use artificial limb is a big thing. It comes in the post-prosthetic training. That's when your PT and your OT and your prosthetists work together to train you how to use your prosthesis, how to take care of the prosthesis and everything. And you have to start living your life as a new amputee and learn to live in that, and then the whole team can help you to achieve that. So what is the aim of rehabilitation? What we want to achieve? We want to give you the maximum independence possible in the highest level what you can, with the most efficient gait possible. Okay, because sometimes when you do compensations with prosthetics and weaknesses, you will spend a lot of energy. We all only have a certain amount of energy in a day. We don't want to make our tank empty by 2 o'clock in the afternoon. We want to take it to the end. So the efficiency is very important, and also giving you the highest level of independence is the utmost aim of rehabilitation. Patient-centered, goal-oriented rehabilitation and so that we can take you to your goals and your line. So as physiotherapists, what do we check? Very briefly, I'm not going into much detail at all. We check, when you assess, we check your physical capabilities, right? What you can do, what you cannot do, and what level is amputation. What is your pre-amputation lifestyle? And then what you want to get back to, right? What is your existing medical conditions? What are your expectations, the realistic expectations, whether we can meet that expectations? Existing medical conditions is very important, because I want to share a small story of a patient we have in the clinic right now at Insta Physical Therapy. Is a patient who has a crush injury, has to go for left below knee amputation. At the same time, because of the crush injury, because of the shock, major shock he had in his body, his neurological system shut down. So basically, his both upper limb are weaker. The other limb, the right limb, is also weaker. Basically, now you're rehabilitating a quadriparesis patient with amputation. Just imagine how challenging it is. But we are working with that patient, because the patient is very, very motivated. He wants to get out of the wheelchair. He wants to stand and walk and get back to work on any level he can. He wants to be a productive member of this community. So sometimes the amputation comes with associated medical conditions. So we have to be ready to take care of that. And it is challenging, but nothing is impossible. So for this particular patient I'm talking about, we are doing a complete neurological rehabilitation along with the amputee rehabilitation and putting it together to enhance his life and to make him better. There's a lot of challenges, but we are working with that. So stump care is very important in amputation. So make sure the stump is in proper shape. Even when they do the surgery, they make sure they have that conical shape in the bottom. And we have to make sure as a physiotherapist, not a lot of swelling, you're not developing any sensitiveness to the stump or any neuromus in the stump. And phantom pain is another big thing we have to deal with sometimes. Not everybody gets it. Some of them gets it. We have to deal with that. Phantom limb management for amputees itself a separate topic. I don't want to get into too much detail about that. We know how to manage that as well. And stump bandaging is very important, and stump care is very important, and strengthening is very important as well. So coming to the exercises, I'm going to show you a few slides of different exercises of things to do. The very important position for all lower limb amputations is prone lying. You have to lie on your tummy at least half an hour to 1 hour a day. There's a lot of exercises you can do on that too, but this is very important to prevent the flexion contractures in the hip. And also it's good for doing exercises for the spine and other things, weight bearing, because you need to sometimes used to have a crutches or a cane or something like that upper body. You need to have a good upper body and core strength as well. So the very important position for any lower limb amputees is lying on your tummy. Okay, this is the picture I think from Physiopedia and copyright to Otterbock. And this one I think copyright to Medbridge. This is one simple exercise we are showing here, how to doing a bridging with the stump with the roll underneath. See that I didn't put the towel under the knee. It's under the stump there to do bridging and things like that. There's a lot of do's and don'ts in exercises for amputation. And you can see here this lady using a prosthetic and doing a side plank, and this is one of the core stability exercises. And this guy is doing a dips, and with a single leg dips, it's a little harder one to do because you need very strong upper limb as well and core. And there's a lot of devices we use in the practice, and also you can use it at home for your strengthening. You can see here he's doing the reverse things to work in the upper body and the core and everything. At the same time, weight bearing training for the process as well. There's upper limb amputation exercises. I just put a small slide to show what are the different exercises you can do for the upper limb amputation as well. Mobility important, strength is important, stability is important, and make sure it's a functional residual limb, right? And then carrying off that, and then getting it ready for the processes, and with the processes how to attain function and the goal. So those are the small things, you can check it out there. For the lower limb, there is tons of exercises. Actually, we are not going to go into detail. I just put one slide for you to know what are the different things you can do to strengthen your core, your important leg muscles, and for endurance and strength and stability. And also cardio stamina is very important also for amputation, because the energy efficiency is very important, right? Gait retraining is very important component of amputee rehabilitation. We needed that to improve the symmetry on both legs, because a lot of times what happens when the amputee stands up, for normal human being, the center of gravity is just in front of your second sacral vertebra. That's where the line passes through. Most of the time when the amputation happens, if I have my left side amputation, below knee amputation, I tend to move my center of gravity towards the right foot, right? I shift my center of gravity because the way I position myself when I'm standing. That's something we need to correct, change the center of gravity back to neutral with the prosthetic leg, right? That's a very important component of gait retraining. And a lot of changes in biomechanics. It's not the same with the prosthetic leg, so we have to train the brain and the body to adapt to that changed biomechanics and without any compensation. That's a big challenge for the prosthetist and also the physiotherapist. And any kind of secondary consequences we have to deal with. So that's a gait training thing. Right now we have some patients on gait training in amputations. It is pretty challenging, but they are doing it. I love that motivation from those patients. So there are different things we address during the gait retraining. I just put like 6 points here. What are the main things we'll work at? The one important thing is the prosthetic knee flexion, especially for the above knee amputations. There are different types of prosthetic knees. There is mechanical knees, there is micro chip knees. We are not going to details of that. So based on what kind of knees it is, we work differently with it. And also we very much important in the core stability and trunk control, the trunk rotation and arm swing. That's very important, because your trunk rotation is very important for the pelvic rotation and arm swing. This goes hand in hand for your gait training. And also how to load the prosthetic leg, how to load the prosthetic toe. That is very important. And maintaining your stride length. Sometimes with prosthetic legs, people take small steps and try to take the weight off that amputated leg and try to put it on the regular leg very fast. That's a very common thing we see, and how to work with that. And also symmetrical width of walking. Are you maintaining your width of walking? You're not doing this or this, and that's very important as well. Pelvic rotation is a very important component. That is why we do a lot of pelvic tilts for the amputation patients, right in post-surgical phase and also pre-prosthetic training. Pelvic tilt is a very important skill for the amputation patients to learn, right? Very important for gait training. So we have to start the pelvic tilt training right in the beginning. Everything around the pelvis and the hip, it's a lot of focus on that for the amputee patients. That's very important on that one. So these are the small things we address during the gait retraining. Balance retraining is another component, okay, because you lost a limb and a part of the limb, and then how to balance with yourself with the prosthetic. It's a new training for your brain. That's something we spend a lot of time in the parallel bar, in the mat and things like that. Mirror therapy. This we do for our neurorehabilitation as well, for stroke patients, multiple sclerosis patients, spinal cord injury patients as well. We incorporate this for the phantom pain rehabilitation for the amputees as well, for upper limb or lower limb. There are steps to follow. There are things to be done to retrain the brain to relieve the phantom pain. Phantom pain is a pain comes from the limb you don't have. The brain still perceives there is a limb existing there. So we have to trick the brain a little bit with this mirror, and there is a procedure to follow. Mirror therapy is very common in neurological rehabilitation, and it's very helpful in amputee rehabilitation as well. There is a lot of research and evidence-based articles published on mirror therapy in amputee rehab, and we follow this in the clinic as well. I also found this very nice material which I want to share with you. This is developed by International Red Cross. I just put the link in there. If you click the link, you can go view this document. Some beautiful exercises designed for prosthetic rehab, and anybody can download it. It's free, and you can do most of these things at home as well. And if you have any questions about it, feel free to reach out to your physiotherapist. They can help you. And never do a wrong compensatory movement. It's not good for you. So this is a great resource which I love to share with you guys. Prosthesis plays a very important role in amputation, and we are so glad in Edmonton we have Scott and his team at Northern Alberta Prosthetics and Orthotics. They take care of the patient so much. They're very good in selecting the prosthetics for you. They've been in the business for more than a couple of decades, and we love to work with them. They take their time. Sometimes we sit on the phone calls like half an hour at a time, a lot of phone call, and they can come here to work with your physiotherapist in your gym, in the parallel bar. If you have any issues, great, they do a great job, and kudos to Scott and his team for Northern Alberta and Prosthetic and Orthotics. And you as a patient have to care for your process as well. You cannot overdo things. You have to protect your stump. You have to protect the processes. And also do not ignore that stump. You have to take care of it in terms of soft tissue management, strength and conditioning and inspection and everything, right? And you can have your amputation rehab in the clinic, even at stump stages. You can even do it at home. Once you finish your prosthetic fitting and training, you did some sessions with the physio already for gait and balance training. Then after that, if you want to continue some things at home, we can help you with tele-rehabilitation as well. So it can be doing that right after the amputation. Mostly you will be in the hospital, and mostly it's a hospital setup thing, while you're waitlisted for public rehab services, right? And sometimes there's a long wait list due to so many reasons. They can only help so many people at a time. You don't have to sit and wait. You can reach out to us and private practitioners to get help, who are trained in amputee rehab, to get help, so that when this spot is available, you can go take that rehabilitation from the hospital as well. Even after you completed your hospital rehabilitation, you can come back to the private practice to continue to work with your amputee rehabilitation to take you towards your goal, or return to sports, or return to work, any kind of high level activities as well. And returning and functional return to work and sports and tune-ups, a very important thing. We do have a lot of young amputees with great goals. They need to be productive in the community. At the same time, they might have some sports goals as well, which we need to help them. So these are things we can do as a physiotherapist, either in the home setup or in the clinic setup. What is the physiotherapist? What is our overall the whole gamut of role we play? We advocate for you with the insurance companies. We advocate to fight for your funding, to do objective outcome measures, and to do proper assessment and send the proper report to get funding for you, to advocate with the community, advocate with other associations, help with your challenges, whatever challenges it can be. You can ask, why this prosthetic is not fitting me? Why I'm walking like this? Why I still have pain in my stump? Why I'm still feeling that leg is there? So a lot of these challenges, we are going to help with you that. And other whole aspects of rehabilitation, communicating with other caregivers, the multidisciplinary team, your doctor, your physician, and your surgeon, your occupational therapist, and your peer mentor, everybody. We communicate to everybody, make sure that all aspects of rehabilitation is taken care of. And also, we train you for the first basic skills, like how to get up from the floor, how to position yourself, how to change positions in the wheelchair, how to do standing, how to do gait retraining, how to symmetrically weight bear, all those things. And the second advanced skill, I call it, is like your stamina, your cardio stamina. Return to the meaningful recreational activities or vocational rehab things, how to train, or sports, everything like that. So there are different stages we work with. It depends on your needs. That's what we do as a physiotherapist in amputee rehab. So we help you to return to you, whatever that you can be, right? You want to play golf, or you want to spend time with your family and friends and grandkids, or you want to participate in competitions, or you return to work in a regular or modified duties, we can help you with that. So that's in a nutshell amputee rehab. So give you some insight of what is the role of physiotherapist and why you need to take care of yourself. And there is different stages, how we come in every stages of your amputee rehab. And you don't have to sit at home when you're waiting for the wait list for the hospital, or even after you discharge from the hospital. There are places you can go and get trained and get fit in life. Thanks for listening. I'll see you in the next episode. Bye.